that leads me to introduce Andi Dolan of Travers Benefits. She is an expert in the area of health insurance, both from a small group business perspective as well as Medicare. And so I asked her to come and give a talk on Medigap versus Medicare Advantage. And I will tell you, it's a highly complex topic. It requires some background information on Medicare itself to understand really what Medicare Supplement policies or Medigap policies and Medicare Advantage policies, what they do and why they exist. And so it's a very, very popular topic. We've done it multiple times, and I'm so happy to have Andi Dolan here to give us this information today.
I'm going to start off talking a little bit about Part A, B, and D. Those are the parts of Medicare. And ironically, those are my initials. So first off, we've got Part A. Part A is hospital insurance, okay? But before I get into what are the parts inside of Part A, you should know that you're entitled to Part A, okay? As long as you've worked 30 working quarters in your career, 10 years, you become eligible or you become entitled to Part A. What does it cover? Well, it covers inpatient care in hospital, skilled nursing facility, inpatient care in a skilled nursing facility, also known as SNF, home health care, and hospice care. The way that original Medicare measures your use is a benefit period, okay? And a benefit period is measured based on the day you're admitted into a hospital. So you are admitted into a hospital, your benefit period begins, you're there for 60 days. The benefit period ends when you've not gotten any inpatient hospital care in a skilled nursing facility for 60 days in a row. If you go into a hospital or a skilled nursing facility, after one period ends, a new period begins. You must pay the inpatient hospital deductible each benefit period. And there's no limit to benefit periods. $1,364 is the deductible that's attached to each benefit period, okay? Meaning I go into the hospital and basically when I pull in the parking lot, I'm going to write them a check for $1,364. For the first 60 days in the hospital, I pay nothing while I'm there. I've already paid my deductible, right? Okay? Days 61 through 90 is $341 a day. That's already confusing, isn't it? Then we've got these lifetime reserve days, $682 per day after day 90, and then you've got a bucket of 60 more. Well, so what's the math here? It's very, very confusing. And then after 150 days, I pay all costs of hospital care, okay? Here, I like this slide. It really represents what I just said and what the costs, what the risks to you would be. So day 1 through 60, it's $1,364. Days 61 through 90, that 342 value at 60 days there, 30 days, that equates to $10,000. Then 91 to 150 days, my potential risk is beyond $40,000. And then even after 150 days, who knows? So that's a lot of money that I would be open to. Okay? If I'm admitted in a skilled nursing facility, again, it's a little goofy because in order to get admitted into a skilled nursing facility, I have to spend at least 3 days inside a hospital, and then I get admitted into an SNF. Okay, and for days 20, first 20 days, 1 through 20, it's free. Ooh, yay. Okay, days 21 through 100, it's $170.50. Here's said another way, skilled nursing facility, here we are again. I've been in the hospital for 3 days. I have to go to skilled nursing. I've already spent my deductible, okay, $1,364. Then days 1 through 20, no charge, thank you. Then days 21 through 100, $13,000, almost $14,000 that I would be open to. And then after day 100, who knows, okay? Home health care, what's covered? Medically necessary part-time or intermittent services, skilled nursing care or physical therapy, speech therapy and pathology services. Services must be rendered by a Medicare-approved facility, okay? Hospice care, if you need hospice care, you have less than 6 months to live. All items, services needed for pain relief, medical, nursing, and social services, DME, which is durable medical equipment, drugs for pain relief, aid for homemaker and services, okay? So that was A. That's a lot of exposure there. I just want to make sure you guys feel kind of educated here on what it might cost you if you were in a situation. What is Part B? Part B is medical insurance. It helps cover medically necessary services. Services are supplies that are needed to diagnose or treat your medical condition and meets accepted standards of medical practice, basically Medicare-approved services. And it also helps to cover some preventive care, some, not all, some, okay? Flu shots, shingle shots, items like flu shots, and detect early stages of illness and treat when it's best for you, okay? You pay nothing for most preventive care services, and you get services from a healthcare provider who accepts Medicare. Part B, you have a $185 deductible. So going back to, okay, if I needed services under Part B, I'm going to pay $185 for the year, and then after that, I'm open to 20% of costs for all of these services. So ultimately, you could be open to risk when you're using your Part B. Does that make sense? Yeah? Okay. What does the cost? What does it cost? Part B premium for 2019 is $135.50. Okay? And in 2020, it will be, or the proposed value is $144.30. They have not yet released that. It will be coming out shortly. Okay? What you should know is that if you're the lucky ones who have earned a really good income, okay, in your life, if it's above the IRS threshold of a certain value, you could potentially pay an additional charge for your Part B premium, which is called IRMA. But it's also, it's a surcharge. So just be mindful of that when you're going through this process. You do need to enroll in Part B. That's something you physically need to do. Part A, you're entitled to it if you've worked those working hours and you've had your funds taken out of your paycheck. But here in Part B, this bulky situation, I have to physically sign up for it. Okay? When enrolling in Part B, know when you're going to be drawing your Social Security. That's one of the key things to this, is that sometimes people, you know, they feel this is where you need to talk to your experts. This is where you need to talk to your financial planners, your trusted accountant, your trusted financial advisors, okay? On when it is, when should I start drawing my Social Security? Because what happens with Part B, they can build a bridge to your Social Security and take that $135 out of your Social Security check, and they'll send it to CMS for you. So be aware that you should be mindful of that process. If you are not drawing your Social Security, you will be billed quarterly. So you'll receive a $460 or $406 bill every quarter to pay for your Part B premiums. Okay? So Part B, it's medical insurance. The Part B premium for 2019 is $135.50. If your wages were higher 2 years prior, okay, you might have the surcharge, so be aware of that. You can enroll into Part B upon aging to 65. And I'm not really going to get into the ICEP, the OEP, and all of that stuff, the MEP and the AEP. I want you to know when you're aging on to 65, that's your time to get into the program if you're ready, okay? If there's other certain circumstances that might prevent you from wanting to enroll in Part B, maybe you're in a group health insurance policy, maybe you're in a situation, but every situation is unique, so that's why you should talk to your trusted partners in your situation. But there's a deductible. You pay 20% of the approved, Medicare approved services, okay? Physician services are covered, outpatient hospital service, durable medical equipment, and some preventive care, okay? Now we get to go to D. Everybody ready for D? So, what is D? D is drug insurance. It's Medicare prescription drug benefit. It's optional. In 2006, they rolled this program out. The government, rolled it out, and it's an option. The penalty if you don't enroll into Part D is 1% of the national premium, which really equates to probably less than $100 a year. So, I mean, I'm not saying that you shouldn't enroll in Part D, but just be aware that there is a penalty attached, but you don't have to enroll. It's optional. There are 4 very confusing phases of Part D. I'm not going to get into all of the red zones, but just let you guys know that you're open to risk, even in a Part D program. Risk meaning I'm open to, if I get to the coverage gap phase. First, there's the deductible phase. It's $415. Now, before I get into all that, I want to step back for a quick second and let you know each Part D program has a different carrier, has a different set of rules, has different equations set to it, very confusing, has a different vendor, has a different place where you can go receive the medications. However, these are the ceilings to each of those phases. So if you've got a really weak drug card, you're going to go through this process and hit the value of $5,100, which is the annual out-of-pocket limit through the coverage gap. Once you get through the donut hole, you'll then go to the catastrophic phase. But, I mean, show of hands, it's confusing, right? Yeah. This actually takes it to a different situation that just gives, I think, a better example of what your exposures would be inside a drug card. You've got these different phases, okay? There's a surcharge that's attached to that. IRMA comes back into play, and if your income is above a certain threshold, you would be charged a small surcharge. Formulary lists, it's very important to know that when you are offered a drug card and you're enrolled in a drug card, or even an individual health plan or a group health plan, the formulary is the list of medications, and they change. They can change. They change all the time. In a D card, they can't change for the first portion of the year, a few months prior or after the beginning of the year, but I just want you to be aware that the formulary is a list of medications that's covered inside that program, the program that you purchase. And not every purchase is going to be the same, okay? So now let's get to the meat of it. Key differences in the policies. These are really 3 popular options, okay? And today's talk is about Medicare Supplemental and Medicare Advantage, and that's what we're going to focus on. So, but I do want to make sure that you guys understand that you don't have to have this, and you can go to straight Medicare and have that be your option, but you understand the risk, right? You could potentially have some large medical bills, if not this year, next year. So straight Medicare is original Medicare, no policy. You know that it's limited and confusing. Drug coverage is optional. I have to purchase it. And I'm going to be open to 20% of exposure. Okay? Medicare Supplemental programs are also known as Medigap. Okay? They're not really that popular, although I like to talk about them because I like the way they work. But I also like the way Medicare Advantage programs work too. And it really depends on what is best for you in your situation. However, medically, supplemental programs can cover you near 100% medically. There's no drug coverage inside a supplemental program. You have to buy that additional drug card, okay? So you've got Part A and Part B, and you have a supplemental program that fills the gaps, that covers you and protects you against some of the 20% exposure, or if you were in the hospital and you had that Part A hospital deductible, fills the gaps. Be aware that if you've missed the opportunity to purchase a supplemental program, if you want to buy one later on, you may have to go through medical underwriting. So, meaning, I get sick, and now I want a program that covers me a lot medically. And then they're going to ask me health questions, and they're going to want to know more about my health and my situation, and my premium is going to be affected by that. Okay? There's no drug coverage. In a Medicare supplemental program, you have 3 cards. You have your Medicare card, you have your supplemental card, and you have, if you buy, your drug cards. You have 3, and it's kind of clumpy. However, it does cover near 100% medically for you. To add to the confusion, Medicare supplement programs are titled by the letter. So wait a minute, we've got Part A, Part B, Part D, and now we have Plan. We have Plan A, Plan B, Plan C, D, F, G, H, K, L, well, no H, sorry. I got a little ahead of myself. But G, K, L, M, N. Okay? So in this situation, you'll see, for instance, I'm going to pick on Plan F. That's probably going to be a popular letter today. Plan F is coming off the shelf in 2020. Yeah. If you're in Plan F, that's great. You're ahead of the game. Plan F covers practically 100% of your Part A deductible, Part B deductible, excess charges. This is key. I'm not really going to talk too much about excess charges, but write that down. Okay? Foreign emergency travel, hospice care. Obviously, we know that hospice benefit is already built in Part A, but Medigap fills those pieces that you might be liable for. Okay? Medicare Advantage policies actually came about in 1997. They were introduced, and then later on, 2003, actually, they were born, if you will, as Part C programs. C for choice. Okay? So Medicare Advantage programs, policies, are also known as Part C plans, MA, Medicare Advantage, or MAPD, Medicare Advantage prescription drug. And what I like about the Medicare Advantage program is that the drug card is built inside of the policy, so I don't have to bumble around and find a drug card and figure out what's right and what's good for me. I've got it all packaged together in this nice package, okay? You still have original Medicare. It's managed by private health insurance companies, okay? Your Part B premium, Yeah. What you probably don't realize is that, so let's go back to, remember when I was talking about Part A? I've spent my whole working career working really hard, and I've had money taken out of my check for my Medicare future. Well, now that I'm 65, let's pretend, I'll be 50 tomorrow, but now that I'm 65, I'm entitled to Part A. Well, the money that's been sitting in the Medicare Trust Fund, really it's about an estimated amount, $800 is allocated for my Part A monthly premium that's taking care of me. So $800 is already set aside for me and my medical needs in the future should I need it. And if I enroll into a Medicare Advantage program, what happens is that Medicare Advantage carrier, that health insurance carrier, calls up CMS, Centers for Medicaid and Medicare Services, and they say, Andi Dolan's ready to enroll into a Medicare Advantage program, and we want you to send us the $800 that's allocated for her on her behalf. Bring it on down. Okay? Oh, by the way, she's also enrolled in Part B, and we'll go ahead and take the Part B premium from you too, CMS, so send it on over. So wait, the math is $900 plus is what CMS is sending to the Medicare Advantage carrier to take care of me, okay? And I'm just gonna bump right down to here, and that's why sometimes, you know, I'm sure you guys, you'll be seeing the commercials beginning October 15th for Medicare Advantage programs. And some of those Medicare Advantage programs look very appealing. $0 for a Medicare premium. How can they do that? Well, they're doing that because they're receiving $900 of your funds that you've already been sending to and have been entitled to. Do you see where I'm going with this? And that's how they can create a $0 Medicare Advantage program. They're already receiving the money. Okay? However, be aware that with all the many choices of Medicare Advantage programs, and I'm not going to say names of what they are, but they kind of sound like used cars. They've got odd names to them. But they, you know, it's good. But they're titled uniquely. They're not Plan A, Plan B, Plan F. Medicare Advantage programs, they have Silver Sneaker. They have, I can't remember the other one, Silver Sneaker or another Silver Gym membership. Oh wow, I want to join the $0 Medicare Advantage for the gym membership. But wait a minute, I missed my opportunity to enroll in a Medicare Supplemental program. Now 5 years later I get sick and my risk inside the Medicare Advantage program could be $4,000. Or maybe I'm in a Medicare Advantage program that's an HMO and I don't have any service elsewhere and I want to move down to Florida or I'm going to go down there for 3 months. But now that I've said move, yes, if you do move, that is a special enrollment time period in a Medicare Advantage program, as well as other policies, but just be mindful. I'm just talking about just generally how these operate and how they function. Okay? If I'm new to Medicare for the first time, so I turned 65 October 11th, right. My enrollment time period for the first time into Medicare is October 1. So I need to go enroll into Part B. I'm entitled to Part A. And now that I've got A and B, I might enroll into a Medicare Advantage program for the effective date of October 1. Does that make sense? I'm just initially able to enroll in. And maybe this is my choice. Well, I'm new to Medicare. And I go through the open enrollment period, the annual open enrollment period, which begins October 15th through December 7th. That's the time when, if I miss my chance to purchase a Medicare Advantage program, I can purchase it in a few days from now, and I have till Pearl Harbor Day to make a decision for the following year. Well, maybe I buy that $0 premium plan. Then I'm like, what the heck did I just do? I got something that I don't understand. I felt like I needed to, and maybe I'm going to go down to Florida for a couple months, and I might get my knee fixed down there. I think I'm in the wrong program. Well, January through March of 2020, I can change it around. I can make a decision to move into a different program. But that's a one-time change. Okay, so that's why when I sit down with a client or a prospect or a friend or a relative or anyone, when I tend to talk about this stuff quite a lot, I really want to make sure that individuals understand that this is not a hasted decision, because what you choose for the year, you're kind of stuck in it unless you have these special circumstances. So it's really important that you understand, well, do I feel comfortable with what I'm getting into? Do I understand the components? Can I afford it? Can I not afford it? Okay? So, generally speaking, again, there's 3 types of programs here: straight Medicare, supplemental. You have 3 cards. The timing to come into a supplemental program is a little wonky, but so is coming into an Advantage program as well. Okay. Well, how to align the pieces? How do I put it all together? I don't quite understand. I know that I kind of know what the parts are, A, B, and D, and I kind of understand some concepts about Medigap and Medicare Advantage. It's really to understand that you are unique. Your situation is different. You might work for an employer. You might work for yourself. You might be on an individual policy saying, I can't handle paying these ridiculous premiums any longer. I need to get into a Medicare program. What do I do? Where do I go? Well, you should be talking to people who can guide you through that. When can I enroll in Part B? And what? What am I enrolling into? Who am I talking with? Who are the people that I trust? Maybe talking to organizations that you feel confident in, or talking to your friends and family on. What I like to find out is, what are the pitfalls? What have you experienced? I don't want that to happen to me, so tell me what happened to you, because maybe I can learn from it.